Okay, so welcome back. Thank you for staying with Fox 10 News at 4. According to the American Cancer Society, there's about 100,000 new cases of colon cancers. New cases we're talking about every year. And Dr. Payne is a colorectal surgeon at Infirmary Health. He is in the studio now to talk about two very important topics of concern when it comes to colorectal cancer, and that is risk factors and also screening. So I want to thank you so much for stopping by.
Oh, thank you for having me.
I want to jump right in and talk about the risk factors. What are those for colorectal cancer?
So we start talking about patients with average risk versus increased risk for colorectal cancer. When we discuss with patients, we talk about modifiable risk factors for colon cancer, things that we can do on a day-to-day basis. Alcohol intake is one. Modifiable risk factors such as dietary intake, weight loss. Those are all key factors. Decreasing smoking intake as well.
Yeah. Earlier this week, we did a story on the wife of Chadwick Boseman. She was talking about the importance of increasing awareness for colon cancer, and she talked about the importance of screenings too. Why do you think, or what do you think in terms of how often they're happening? Is it happening enough?
Well, I think that it is. When you think about the incidence and mortality of colorectal cancer in patients that are 50 years of age or greater is actually significantly decreasing. And so we can contribute that to screening. However, we know actually the incidence and mortality of colorectal cancer is actually increasing for patients who are less than 50 years of age. And so all of that is due to screening. And so guidelines have changed for screening for colorectal cancer. In the past, it was 50 years of age, and now it's 45 years of age. And that's probably changed within the past 5 to 7 years.
There have been a lot of changes, and I'm sure you know more of them than I do. But talk about your hope in terms of fighting this.
Well, I think that early screening and understanding signs and symptoms of colorectal cancer is really big. And just understanding and just the public awareness of what we're doing now in terms of getting patients screened at an earlier age.
And we hear so much about the importance of diet, and I know it's not always that simple, but it can help.
Oh, most definitely. We know that on average, diets higher in fruits and vegetables and lower in red meats, just in general, can decrease your chances of colorectal cancer.
So if you are in that age group where it is your time to get that screening and someone's saying at home, I don't want to do that, what's your push?
So it all depends upon risk. And so somebody who is an average risk patient that does not have a significant risk of developing colorectal cancer in their lifespan, those patients have more and more options. And so it can be something as simple as a fecal occult stool test. Cologuard is a big topic now, and so sometimes patients not every patient has to have a colonoscopy. However, colonoscopy is still in probably many regards the standard of care for screening for colorectal cancer, and it's just public awareness and just getting patients in.
We are out of time, but I am curious. We have so many experts who come on all the time, and I would be remiss if I didn't ask you, why is this so important to you? Why did you become a doctor in this field?
I just think that the ability to be able to treat patients, me as a colorectal surgeon, it's unfortunate when patients come in with colon and rectal cancer, but I highlight the point most oftentimes with patients when they come in with the diagnosis that the fight's not over. And so that though the patient may be diagnosed with colon and rectal cancer, that the survivability for colorectal cancer is substantially high. But we do know that the earlier you catch colon and rectal cancer, the better the treatment options are.
All right. Thank you so much for spending time with us today and sharing that message.